Michelle, for listening to us. My name is Kirsten Dunham. I'm from St. Louis, and I have lots of friends and family members with disabilities and other chronic conditions, because that would be called pre-existing conditions. And we really appreciate Senator McCaskill's support for healthcare reform that does give choice and access. I hear from a lot of people who cannot get healthcare coverage, either because their income is just a little bit too high to make Medicaid eligibility. They might be in that 2-year waiting period for Medicare. They're discriminated against in the private insurance market or priced out because of their pre-existing condition. In Missouri, the high-risk pool is way too expensive for people with low or modest incomes who have pre-existing conditions. So this bill that does improve and strengthen access to Medicaid and Medicare will help people with disabilities. Changing ratings and not allowing ratings based on age or gender or health status will address those issues. Removing and prohibiting exclusions or pre-existing condition exclusions will help. And also I want to mention that getting access to home and community-based services for people with disabilities is important. The bills in the Health Committee do include the Community Living Assistance and Supports Act, which would be a voluntary premium program so people with disabilities could pay in and other people too, so the event that they do need long-term services and supports, that benefit would be there. And I also want to say that we need mental health parity, because mental illnesses are real illnesses.
Oh, sorry. No, I didn't know. I thought we were, you have a couple more folks in line? Okay.
Hi, I'm Sarah Phelps from St. Louis. Also want to thank you for being here tonight. I just wanted to refute the assertion that we're really rushing healthcare reform. Missouri's own President Harry Truman first proposed a national healthcare program in 1945, so it's been over 60 years in coming.
Actually, I think the first proposal was in the 1920s.
Yes, but the first national one that's comparable to this, at least from what I've learned, is 1945. But from what I've learned, in the United States, we pay, more for our healthcare than anyone else in the entire world, and yet our outcomes are nowhere near number one where they should be. And we have to do better, and that's why I support President Obama's plan and the public option. So thanks.
Thank you, Sarah.
Hi. My name is Steve Skranka. I live in St. Louis County, and I'm here representing myself, and I'm also Vice President of the Jewish Community Relations Council of Greater St. Louis. We represent 18 organizations from all branches of Judaism, over 50,000 individuals residing in the St. Louis area. We are paying close attention to healthcare bills in Congress, and we strongly support healthcare reform and want Congress to pass real healthcare reform this year. And I'm pleased to say that I understand the U.S. Chamber of Commerce called on Congress today to please pass healthcare reform today, or this year. We certainly agree with the U.S. Chamber of Commerce on that. And since we do, that's a strange and unusual thing. There are many things we would agree with them about, but healthcare reform hasn't traditionally been one. We want healthcare reform that will lower costs, that will give us quality, affordable healthcare choices between private and public plans for all Americans. And I just want to say a minute that speaking as a senior who is on Medicare, the first thing is I believed all the same propaganda that we've heard tonight. And I was absolutely shocked when I reached the moment when I could no longer have Cobra because it ran out, and I paid for it as long as I possibly could because I was frightened about it running out. And then I went around to my doctors timidly and said, I'm on Medicare now, expecting them all to kick me out. In fact, they welcomed me with open arms and said, oh good, we're done with all that red tape from the private insurance companies, and took me around and showed me how many people in their offices they had employed as counter-offensive to the games that the insurance companies would pay when they tried to get reimbursed. And that happened with my ophthalmologist, who told me about being shafted out of $10,000 when the insurance company played games with them with their claims. It happened with my internist, It happened with my cardiologist, and it happened with my urologist. Now, let me also say that I am tired of being peppered with advertisements every fall by Medicare Advantage. I have examined them very carefully. I read them, every one of them, very carefully. As far as I can see, the only advantage is for the private insurance company that's getting paid 18% more out of my pocket to give me the same benefits the government gives me for 18% less. The insurance company, as I understand it, is spending 31% on overhead, and Medicare pays 4% on overhead. Now, Medicare is not perfect, and I certainly support the suggestion of the administration that we have an independent medical advisory commission. I would like to see a lot of this getting out of the hands of the politicians, who we all understand are getting paid $1.4 million per month by lobbyists for the medical device manufacturers, the oxygen suppliers, big pharma, and the insurance companies. That's not a healthy way to make Medicare decisions. We want it in the hands of healthcare providers and healthcare experts. I have noticed, for example, that if I go from one doctor to the other, I am required to have a PSA exam over and over again. We don't need that. Reform can help us with that. That's one way we can cut costs out of Medicare. We can cut costs by cutting their Medicare Advantage bonus that I mentioned, and we can cut costs by implementing treatments that my doctor would like to give me, but which are not approved because somehow we can't get the comparative effectiveness information that is needed in order to get Medicare to reform some of its codes. So you have to play games with the codes and get paid for treatment rather than for sitting down and listening to my complaints. So we can improve the preventive care, we can improve a lot of other things in it, but even as it stands, it's a lot better than my private insurance used to be. Thank you.
My name is Joe Thomas. I'm a lifelong Missourian. I just wanted to say a quick word on the idea that